It seems to me that where Jill started off is important to come back to, that in a time of constrained resources, we need to be really looking at the value of and how to get the most value from what we are spending at the federal level. But it's also critical to realize the limitations of working within a fixed box. And so I want to try to talk to the vision question, which Jennifer Ho raised in the last panel. To me, recommendations 1 and 2 are, I feel funny saying this because they came out of work that Jill and I did together, so I think they're good ideas. But they are particularly good ideas because they're things that HUD has the power to do. They don't need any more authority from Congress. They don't need any more money. So that's really a plus in this environment. But to be clear, you got a sense that this getting the right people into the units they need is not as simple as and uncontroversial as one might think from the earlier panel. You didn't get the controversy on number 1, and it turns out you didn't because Carol didn't understand the proposal. I had a little chat with her afterwards. So in addition to HUD proposing to do better targeting to frail elders with new money that Congress may or may not ever give them. The proposal is about using the authority in existing law to target a share of the units that in the existing portfolio of 250,000 units. People die, they go into nursing homes, they go and live with their family. Units become available every year. Right now, HUD's rules leave admissions preferences entirely up to the owner. 202, unlike, I think, every other federal housing program that I am aware of, actually gives HUD the authority to require owners to give preference to people who need the services associated with the property. I recognize that is not as easy an issue as it sounds, but it is a really important policy direction for HUD to take. There's a recommendation buried within that 202 targeting proposal that I also wanted to kind of lift up. It is about new money focused on properties that where the money is available and the need locally is there to enable properties to serve more frail people with modifications to the physical units. It's not as easy as just saying you need services. Sometimes you actually need physical modifications of the property so that they will serve people with handicaps, et cetera. That takes dollars. We have a program authorized to do those conversions in the 202 stock. We do not have a similar program for the public housing stock. And I just want to flag that there are more seniors actually housed in the public housing program, on the order of 100,000 more than in the 202 program. And the number of people who are 80 and older is almost as large in the public housing program, close to 80,000, as in the 202 program. It's only slightly more. So we really need to be thinking about scarce resources and also directing them to the public housing program, even though it's not called elderly. In the recommendation around the waiting list issue and getting the people who need accessible units into them seems like such a no-brainer, but it's a perfect example of some of the more systemic problems in this system. HUD policies and programs and the operation and structure of the agency are designed to serve the needs of the providers, not to serve the needs of the people for whom the housing is funded and built. If you thought about this from the perspective of the people for whom the housing is funded and built, having a comprehensive waiting list of accessible units throughout a metropolitan area would be one of the first things you would think about doing. So at the risk of being overly blunt, as I usually am, HUD just has to suck it up and do it. Because to think that it is going to come from the providers whose every vested interest is to not bother, it hasn't happened and it won't. And it's another thing that HUD has the authority to do, and HUD could actually go a step further and create the software and facilitate through guidance and technical assistance waiting lists that would work for other people too, not just the disabled. So those things are relatively easy. I think when you focus in on both the supportive housing recommendation and the substance abuse recommendation is where things get really hard. And the supportive housing recommendation is hard in part because of what people began to address in the first panel, but I think didn't go far enough. We have a fundamental misalignment in the administrative geography of our programs. The HHS programs essentially work through the states, and the HUD programs barely at all work through the states. So that's the bad news. The good news is that people are beginning to understand more and more what barrier the misalignment of administrative geography creates, and the era of scarcity we are in might help create the context where a solution is more possible. But HUD has to actually do this consciously. HUD has to actually think about a goal of changing the administrative geography of housing assistance in order for it to happen. And I don't have time to go into some of the ways in which they could do that. So that's one of the problems, is that the savings that the states would realize aren't captured by the current set of providers, so they have no incentive to make the change. But the other big problem is the one that I was very glad to hear Estelle mention, which is in a zero-sum world, if you direct more resources to people with disabilities, you're taking them away from other people. And that is not theoretical. In the 10 years between 2000 and 2010, about 400,000 additional households got rental assistance from HUD. Less than 10,000 of those additional households were families with children. I just want to say that again. You know, we grew some, 400,000, and less than 10,000 of the additional households were families with children. So it is no surprise that the real growth in homelessness is among families with children, and we're making progress on chronic homelessness, right? It's where we've put the resources. So we've got to get out of this zero-sum game. So 2 ideas out there that I want to throw out. The first is, let's not just point the fingers at Congress about how siloed they are. We have an executive branch of government, and even though the agencies are siloed, the White House is not. And it is the responsibility of the White House, of the Office of Management and Budget, the Domestic Policy Council, et cetera, to figure out how much money is going to be allocated to each agency in their budget proposal. And if savings can be realized in the healthcare budget only by making sure that certain types of households have access to housing, and we need to grow the amount of housing assistance resources in order to do that, it is the responsibility of the White House to make that shift. And I think we can't lose sight of that, and evidence, despite what you said, Bill, is a really important part of convincing the White House that those savings can be realized. But the other thing is, even that's all just much too marginal in a world where 1 out of 4 eligible households gets HUD rental assistance. And I was glad to hear, though I didn't fully understand what people have been saying about paying for housing out of managed care, but I don't think it's going to go very far to meet these needs. So I wanted to just flag that the Center on Budget issued a proposal in July that could address both of these problems that I've just suggested, the lack of resources and the administrative geography problem. It's a proposal for federal tax side renters credit to provide additional rental assistance to over 1 million households through a capped allocation of credit authority to states. So you would create more capacity at the state level and an ability of the states to set priorities and preferences for those resources. And the funding would come through tax reform and some savings on the gravely imbalanced spending that our country now provides to enable the most well-off among us to afford larger homes, as opposed to the people who are the poorest and in the greatest need to afford some roof over their heads. So that is on our website at cbpp.org/renter credit. And I'll stop there.
Well, I heard Barbara say that better targeting of 202 towards elders with vulnerable health is a no-brainer, and HUD should just do it. I heard Bill say, and I think he probably thinks this even more now that he's heard that the proposal means all of the existing 202 developments. I heard Bill say unfunded mandate. Where are the services dollars going to come from that make that possible? Brian, what do you think the possibility is that the various state systems will be willing to provide the funds for that unfunded mandate?
That'll be very difficult, to say the least. Of course, they're facing the same challenges that the federal government is around budgeting. In fact, one point that Bill made is when you get into the whole Medicaid space, there's a lot of strings attached to it, and a lot of oversight. There's a lot of nuances in terms of getting paid for services, and it's an art as much as anything to learn. And so they're going to have to go through that process. But what's going to be important, again, is making the larger case, and you do that through the governor's offices. You make the larger case about how this is, in the aggregate, going to be a return on an investment. You got to make the business case using business terminology, and if you can make that case, like this organization, the network I mentioned in Minneapolis, made to our governor's office when I was there, that in the aggregate, this is going to be in the interest of the state financially. So you have to bring the equation has to be larger than just Medicaid or housing appropriation discussion.
Ann.
Can I comment?
Yes, please.
I'd like to comment on that. I think you can come at this from another direction, which is, let's just say hypothetically that you're a 202 developer, your project's in the ground, you got 6 more months before it's going to be occupied. And in your state, you have a Money Follows the Person program that is actively working to take people who are in nursing homes, who are over 62, and help them move to the community. Money Follows the Person leads to Medicaid. Most of these folks, if not all of these folks, are going to have very robust Medicaid benefits, either through the home and community-based waiver or through a demonstration. And I think you can very easily say, okay, we're going to take 5% or 10% or 15% of the units in this 202 property, and we're going to create a partnership with the Aging and Disability Resource Center in our community and the agency that provides home health care and other supports to people who qualify under 1915. And you've got a lovely little package there. It doesn't cost, you don't need any more money to put that together. And I think having done something not anywhere near as creative as that when I ran elderly housing 25 years ago, all we did was go to the Home Care Corporation and say, why are you sending 5 different teams of people into our property when if you just sent one team, they could go from unit to unit to unit and everybody would save money and we would know more about who to call. I don't think you need, I mean, some things that we're talking about need huge rethinking, but some things are kind of common sense. And so I just think that the 202 idea is feasible.